joining us today. Thank you for joining this special event today. Please place the city and the state of where you're zooming in from in the chat. Before we jump in, we want to go into our meeting agreements. Please keep yourself on mute. Keep those distracting noises from interrupting the program. Use the chat to raise questions, add comments, or ask questions. Assume everyone's good intentions, using respectful language and a tone. And remember, we're on camera. If your video is on, we can see everything that goes on in the background. So please be mindful of that. And this meeting is being recorded. So folks who can't be with us today can watch it on our AARP YouTube channel. So good morning and welcome everyone. And our meeting is being live streamed today. So you have a lot of opportunities to watch it. Good morning and welcome to the third year of our program, Journey to Juneteenth. This year, we're focusing on health as we discuss a path to Black health and wellness. My name is Jacqueline Cole and I'm a volunteer with AARP. AARP California is extremely happy to offer unique content to AARP members in California and beyond. AARP is a nonprofit, nonpartisan membership organization for people 50 plus, where our vision is for a society in which all people live with dignity and purpose and can fulfill their goals and dreams. In California, we're focused on developing livable communities for all ages. To learn more about the work AARP is doing at the national, state, and local levels, visit aarp.org/ca. Okay, before we get into the details of the day, we're going to ask you to participate in a couple of polls. So when you see the questions come up on your screen, please provide your answer. Question 1, how many years have you participated in the Journey to Juneteenth program with AARP California State Office? First time, all 3 years, or only attended once? Oh, looks like it's first time for about 94%. And 6% have, this is their first time. So we appreciate your attending. Thank you. Question number 2. How would you describe your health? Excellent, good, fair, or poor? I'm very happy to say that at least half of us feel that our health is excellent, and some 50% of us say that our health is fair. So hopefully you'll be able to get some information today that'll help to improve that. Thank you all for participating in our quick poll questions. We will revisit another poll at the end of this event. Throughout the event today, we will remind you to participate in the chat where you can ask questions, share reactions, send a shout out to individuals you may know, and more. And we are eager to hear and learn from Dr. Tanai Jackson, who will help lead today's conversation. As some of you may recall, Dr. Jackson helped lead our Juneteenth conversation for the last 2 years. If you're interested in viewing those conversations, please check out our AARP California Facebook page or our YouTube channel. You'll see the links in the chat. Today, Dr. Tanai Jackson is our speaker, Dr. Tanai Jackson is a U.S. historian of the Civil War and Reconstruction. She focuses on the abolition of slavery and meanings of freedom. Dr. Jackson earned her PhD at the University of Maryland, College Park, and is currently assistant professor of history at Cal Poly San Luis Obispo. She is a native of San Jose, California. Welcome, Dr. Jackson.
Thank you. Thank you very much, Jacqueline. Thank you for having me. Okay, so before I get started, I would like to call your attention to the chat again. Again, we will be sharing information related to health and wellness in the Black community. For those who live outside the state or outside areas relevant to the information, I encourage you to find a local organization delivering similar resources in your community. Okay, I'm going to share some slides, and I'm going to ever so briefly give you a very broad overview of how I think one of the questions when we talk about Black health is, why are there health disparities by race? And how did we get to this point? So I'm going to give us a sort of overview. I'm going to touch on some things I touched on the last 2 years, and then give us just this very broad overview of times from Juneteenth until now and how health disparities come about. I'm going to share my images here with you. Okay, welcome everybody. Again, I want to start our opening history moment here back at the time of Juneteenth. To recap some of the things that we've talked about before, which had to do with what is Juneteenth, and then also how community operates in defining freedom and in bringing about the abolition of slavery and Black communities since in terms of politics and policy and just how we get to this point. To recap, the final battles of the Civil War, the war that ended slavery in the United States, were fought in June 1865 in Texas. You can recap this whole bit on the first AARP Juneteenth video that we have. On May 26, 1865, the last standing army of the Confederacy, the Army of the Trans-Mississippi West, surrendered. And it was weeks later on June 19th that the final military order for freedom, was issued in Galveston. Although it would not be until December of that year that the 13th Amendment was passed, guaranteeing slavery's demise. The war revealed the disparities in Black and white health that already existed in the US. This picture you're looking at here is Julia Wilbur at the Louverture Hospital in Alexandria, Virginia. This hospital was built in 1864 for non-white soldiers and civilians. It housed both Black and Native American soldiers at the time. Prior to abolition, enslaved people were often responsible for their own health, and large plantations had community structures in which healing was the work of particular members. These enslaved healers cared for the day-to-day health and wellness of enslaved people who performed high-risk work, faced daily violence, were confined without free mobility, and as a result were susceptible to debilitating mental health issues. In both northern and southern cities, Black people, enslaved and free, were excluded from hospitals and turned away by white medical practitioners. In the North, there were a handful of licensed Black doctors. The vast majority of what was just a few had been trained in Scotland or Canada, denied entrance to US medical schools. The American Medical Association excluded Black membership at their founding in 1847. In other words, Black communities have historically been responsible for their own wellness. And the Civil War constituted a health crisis for all Americans, but Black people found themselves at a particular disadvantage. During the war, disease was rampant. Soldiers from secluded areas were exposed to diseases for which they had no immunity. For many formerly enslaved soldiers, the war was the first time they had been away from the plantation. In addition, the combination of humidity, tainted water supplies, poor sanitation, and crowding in military camps created the perfect breeding grounds for germs. And illnesses like diarrhea, dysentery, malaria, typhoid, and pneumonia reached epidemic levels. It was war. Black medicine was a necessity at this time. Black surgeons began to be hired at a point in the war when the death toll was growing and resources were shrinking. Health crises were rampant. In fact, 2/3 of the roughly 620,000 Civil War fatalities came from germs, not guns. The military needed all hands on deck, especially to care for the Black soldiers and formerly enslaved refugees leaving slavery by the tens of thousands. About 20 to 25 doctors in all treated Union troops. These were commissioned medical officers. The rest were what were called contract surgeons. That is, they weren't part of the Army, which was something typical for both Black and white doctors. Black women made up about 10% of Union hospital workforce. For those interested, one of them, Susie King Taylor, wrote a memoir that you can find online and read. It's called Reminiscences of My Life in Camp with the 33rd U.S. Colored Troops. And it was published in 1902. To meet this health crisis that was occurring, the first hospital dedicated to Black patients opened in 1862 in Washington, D.C., the Freedmen's Hospital, which is now currently the Howard University Hospital, still a preeminent hospital in the United States. In particular, so many people seized freedom and escaped slavery in the chaos of war that cities became their new home, and they were forced to deal with a formerly enslaved population who had escaped their condition with nothing and were excluded from medical facilities. For the most part, makeshift hospitals were established near military forts to treat soldiers, families, and again, the tens of thousands of refugees fleeing slavery. The first hospital dedicated to Black health, this one here, the Freedmen's Hospital, was established in Washington, D.C., which was a major location of Black migration during the war. Many of the doctors who began practicing in the field during these years continued on at Freedmen's Hospital after the war. After the war, benevolent mutual aid societies sprouted up to meet the needs of the people, which varied by region, but always included medical care, burial services, schools, and poor relief. During the height of Reconstruction, Black communities made major advances in healthcare. After the passage of the Reconstruction Acts, Black men in the South could vote and hold office, and in these early years, they did so in large numbers, particularly at the state and local levels. After all, every place there had been a large plantation, there was now a large Black electoral majority. Black voters and office holders were committed to caring for the people who had lost and gained everything. Freedom was gained, but it was nothing but freedom. Having worked their entire lives for no compensation, freedom came without severance pay. Older people were in particular danger, often unable to work after laboring their entire lives under the ravages of slavery. Local Black office holders ushered in new policies for internal improvements to combat disease and called for the establishment of some hospitals and facilities to care for those who could not care for themselves, mainly those with chronic illness. And even then, it was difficult to get white doctors to care for Black patients even after integration was legislated. This proved particularly true for mental health care. Most people continued to rely on benevolent associations for care. But during this time, there was what's called a Black hospital movement. Provident Hospital was a training school for nurses, and it was the first Black-owned and first integrated hospital in the United States. It opened in 1891 in Chicago by Dr. Daniel Hale Williams. In response to the lack of access to support and training around the country, up to 14 Black medical schools were created between 1865 and 1910 to deal with this new free population. In 1895, Black doctors established the National Medical Association, still excluded from the American Medical Association since its founding. They were likely also responding to the counter movement taking place at the end of the century that were taking the gains of Reconstruction. The gains of Reconstruction, they were short-lived. The gains made during Reconstruction hit a wall at the end of the century. A backlash to the political participation resulted in violence and terrorist organizations like the Ku Klux Klan and ultimately exclusion and Jim Crow segregation. In 1896, the Supreme Court established the constitutional right of segregation in the United States, which led to widespread segregation and exclusion across the country. Plessy v. Ferguson was actually an interesting case. In Louisiana, streetcars had started to segregate, and Homer Plessy actually challenged this in the Supreme Court. He lost. Sometimes I call this when activism goes wrong. He thought that by challenging segregation laws, segregation would be overturned. The opposite happened. As a result, disenfranchisement came about in overwhelming waves. Again, everywhere there had been a large plantation, there was now a large Black electoral majority. And state legislatures and constitutional conventions had enacted these sweeping democratic reforms, which led to increases in Black healthcare, the Black hospital movement, and the such. But violence and rigged elections at this point resulted in disenfranchisement. Without Black voters or office holders, separate but equal was anything but. Black facilities received dramatically less funding than their white counterpoints under segregation. Just as with schools, medical facilities did not receive their fair share from local and state budgets. What was more, white facilities could turn away Black people. Imagine this in the case of healthcare. If you are injured or have cancer or complications arise during childbirth, and the white hospital is the closest, too bad. Ambulances were even segregated, so Black patients could not ride in ambulances in many places. Oftentimes, Black-owned funeral homes allowed the use of hearses to transport patients in a sort of ghoulish irony. Many a patient died in a hearse as the driver drove from hospital to hospital trying to find one that would accept their patient. Once again, Black communities took their medical health into their own hands. This is Dr. Dorothy Farabee at the Delta Clinic in 1938. She directed the Mississippi Health Project, a project sponsored by the Alpha Kappa Alpha sorority to provide healthcare to sharecropper families in Holmes and Mound Bayou counties. Throughout the summers of 1935 to 1942, she additionally became an active member in the civil rights movement and a member of the National Council of Negro Women. In the fall of 1949, she was elected president of the organization. Here she augmented the organization's efforts to promote healthcare and education and continued its work to end discrimination against African Americans and women in the military. As president of the NCNW, she issued her 9-point program, which outlined a plan to achieve fundamental civil rights through health and legislative initiatives. Through all of this, she remained a full-time obstetrician. One of the people who really pushed healthcare into the public eye and made it a major part of the civil rights movement and publicized it was Martin Luther King Jr. In 1966, while speaking to the Chicago Freedom Festival, he planted seeds about this concept that he called the other America. And I think that this is an important point to understand why health disparities still exist in the United States. In this speech to the Chicago Freedom Festival, King said, "The purpose of the slum is to confine those who have no power and perpetrate their powerlessness. In the slum, the Negro is forced to pay more for less, and the general economy of the slum is constantly drained without being replenished. In short, the slum is an invisible wall which restricts the mobility of persons because of the color of their skin. The slum is little more than a domestic colony, which leaves its inhabitants dominated politically, exploited economically, segregated, and humiliated at every turn." His point that segregation was a way to isolate people geographically and then exploit them is central to this idea we're understanding, right? I mean, if people are cordoned off geographically and receive less resources and hospital and medical care are segregated, then medical care in those areas is not going to be as equitable as it is in areas that are receiving more funds to take care of people. So you might only have, one hospital that's sort of far away, as opposed to neighborhoods and areas that have multiple hospitals, medical care, and have access to all of those as opposed to being excluded. The Medical Committee for Human Rights, a group of healthcare activists whose work in the late 1960s and early 1970s drew attention to the inequities of healthcare in the United States, are pictured here during this march during the civil rights. Recognizing these discrepancies, communities across the country expanded healthcare programs in communities, but segregated Black neighborhoods still received less tax dollars per capita, which results in this type of exclusion. Ironically, the fight for integrated healthcare comes about with the fight for Medicare. Just sort of like it was, during the civil rights movement, while we see an act like Brown v. Board of Education desegregate schools, the fight for Medicare ended up desegregating hospitals. One of the things that activists realized in the fight for Medicare was that they didn't want to do it like they had done schools, do this sort of piece by piece, right? The way that schools were desegregated was incrementally, so that schools desegregated on their own and then came into the fold. In this case, the government threatened to not give any Medicare money to any hospital that was still segregated. This kicked off a sort of process, a wave of processes in which hospitals desegregated as a means to receive Medicare money. It happened at the last minute, right? And so just 3 months before Medicare rule kicked in no place in the United States were there more than 50% hospitals integrated. In some places like Mississippi, only 4% of the hospitals were integrated just 3 months before Medicare kicked in. With only 2 weeks to go before Medicare took effect, 79% of hospitals nationwide had become segregated or desegregated, and half in the South were still segregated. But by 1967, 95% of hospitals had been desegregated in the United States. So after segregation, what now? Decades of residential segregation have concentrated Black people in some areas and white people in others. Redlining, which had begun after the New Deal, drew lines around and devalued Black neighborhoods, reinforcing and worsening the unequal distribution of resources. Inequities in medical funding, which is largely based on property values, which had been devalued, intensified health disparities in racially segregated Black neighborhoods. That persists to this day. Practices continue to have an effect and desegregation. And while Black hospitals received less government money than white hospitals under segregation, Black hospitals closed under integration. And all the government money went to the remaining white, now integrated hospitals. Segregation continues. American hospitals are still segregated, and access to healthcare in Black neighborhoods remains less than in other neighborhoods. Hospitals and primary care practices in segregated neighborhoods have a higher likelihood of hospital closures. I just want to show us some images from the Black hospital movement to end with. These are images, here I'll show you a closer up one first, by Charles Alston. It's called Magic in Medicine and the Modern Medicine, Studies from a Harlem Hospital. It's from the Harlem Renaissance, and he did artwork for these different hospital movements. But I want to bring in our panel now to discuss healthcare inequities in our own time. Let's get some experts in on this topic. Hello, everybody.
Yes.
Bring us back in. Okay. Today we have a special panel who will help enrich our conversation on this. Like I say, I want to bring in some experts on this. The AARP remains focused on livable communities for all ages, which includes connections to health services and supports in all communities. To help us with the rest of our discussion, we are joined by representatives from the California Black Health Network and Eyes for Love Nursing. First, let me welcome Tia Delaney Stewart, who wears many hats, but today she is wearing Executive Director of Eyes for Love Nursing. Welcome, Tia.
Hi, thank you so much, Dr. Jackson. Can you hear me okay?
Yes, thank you.
Okay, wonderful. So yeah, thank you for that presentation. It was a great way to jumpstart our conversation today. As you mentioned, I'm Tia Delaney Stewart. I'm a registered nurse with my master's in nursing, and I'm also licensed as a clinical case manager. And it is a blessing. I didn't always think it was a blessing, but it's a blessing to have over 30 years of experience within the home health, palliative hospital, and hospice industries, either in the administrative or clinical role. And so, as you mentioned, in my community, I wear many hats. Eyes of Love Nursing is an organization I founded and operate, and it was designed to address the lack of diversity in the nursing industry because, unbeknownst to a lot of people, less than 7% of RNs are Black. And my goal is to work with our youth to educate them on the amazing career of nursing and also provide them with tools to successfully navigate that nursing school journey. Additionally, I volunteer as the Health Committee Chair for both the National Action Network Los Angeles and the NAACP Inglewood South Bay chapter. I work per diem as both a hospice nurse and nursing instructor a couple of times a month for a couple of really large health organizations based here in Los Angeles. And then my day job, I work in the DEI space for a national health focused organization. But most importantly, I'm a wife, a mom, a daughter, a sister, a granddaughter, and a friend, which are really the roles I love the most. So I wanted to share a little bit about why I do wear so many hats. I mean, my family and friends would probably say that I'm an overachiever, but really it was my direct observation of the healthcare inequities, the social determinants of health, and the lack of clinician diversity within the Los Angeles population that really led me to want to collaborate with various organizations to design policies, procedures, regulations, and resources with an intentional focus and goal of improving the health and health-related outcomes of the marginalized, the underrepresented, and the vulnerable members of our community. So that's one of the reasons why I joined AARP. Well, I joined first because I'm AARP age appropriate, but most importantly, because it has really provided me the opportunity to have access to valuable local information and resources for the communities that I serve, and the privilege of volunteering on some of their committees to help them serve those communities as well. So I am truly humbled to be here today and part of this necessary conversation.
Thank you. Thank you so much, Tia. Next, I am happy to welcome Rhonda Smith, Executive Director of the California Black Health Network, among other things. Rhonda, welcome.
Thank you, Dr. Jackson, and thank you to the AARP team for hosting this event today and having this important discussion. And so I am the Executive Director of the California Black Health Network. I had the pleasure of stepping into this role right in the thick of things during the summer of 2020. So almost 3 years ago as the interim ED, and really thought, despite everything that was happening in that moment in time, there would be opportunities for an organization like CBHN to really focus on the impact of COVID at that time and everything else, all the other health disparities that the Black community here in California suffers from. And generally speaking, before COVID, the life expectancy of Black Californians was about 5.5 years less than the state average. I believe COVID probably has added another year or two to that. So we at the California Black Health Network, from the very beginning when the organization was founded in 1978, have focused on improving the health and well-being and life expectancy of Black Californians. We turned 40 this year. So that's 40 years of officially being a 501c3 and a nonprofit. And our work really focuses on outreach, education, policy and advocacy work, and programmatic work to try to move the needle in closing the gap in health disparities and improving life expectancy. So our vision is to create a California where every African-American and Black immigrant has the opportunity to live a long life free of violence and racism and health inequities. And we do that every day, or aspire to do that every day, through our mission to ensure that all Black Californians, no matter, I'd say, who they love, where they live, how well educated they are, how much money they make, how they self-identify, or what their housing status is, or even where they're from, has the opportunity to have access to high quality, equitable primary as well as behavioral health care. And so we also, in response to what was happening in the summer of 2020, we launched the Campaign for Black Health Equity, which is our multi-year initiative, not only as a nonprofit to raise funds, but also to invest those funds in 6 core areas that we believe really represent the formula for closing that gap in health disparities. And number 1 is our Black Health Agenda, which is our statewide strategy and plan to do that across 10 counties here in California. Our Black Health Network, kind of being true to our name, we started a virtual community also in response to COVID, since we couldn't get together and have community convening events anymore. But we have a virtual community of members across the state that come together to connect, collaborate, communicate, and do some virtual networking. And so we strongly believe that any issues in our community that is about us and for us has to be changed by us as well. And so we have about 450 members across the state, of which Mr. Cook is one, and has been very active in our membership activities. And so together there's more power, and at the end of the day, we're working towards the same goal. So better to collaborate and join forces in doing that. We also host health equity forums where we feature and showcase subject matter experts and thought leaders in the health equity arena. We get involved in policy and advocacy work, really focusing on getting to the root causes of health inequities. And so some examples are addressing the racism and racial bias that is embedded into medical algorithms that drive patient decision-making that ultimately result in poor outcomes for Black and Brown people. We also have a major health education initiative called the Health for Life Initiative, which is aiming to improve health literacy of individuals across the state so that we can create a more empowered community of individuals who really take ownership and charge of their health and well-being. And then health equity begins with access to healthcare. So we are a certified Covered California navigator. So we have a network of certified enrollment counselors across the state who make sure that people who are uninsured, no matter who they are, actually get access to the proper healthcare coverage and get re-enrolled, and so they can stay insured. And so those are the things that we are involved in every single day, and happy to be part of the session today to talk about how we can address some of the systemic and structural barriers and have a conversation about what's happening in our community today and how that relates to some of the things that Dr. Jackson also shared. So thank you again for being here.
Excellent. Thank you so much, Rhonda. I'm excited to have this conversation. Great panel today. Fantastic. Okay, let's bring our panel together, all of us together so that we could ask some questions and get in here. And I definitely want to hear from our two panelists today on how health equity plays out in our own world today. I have a few questions I'll start with. We'll wait for Tia to get up here on the screen with us as well.
I'm here, so I can hear you.
Okay, fantastic,
I think she's
fantastic.
just waiting to spotlight me.
There you are. Excellent. Thank you so much, Jacqueline. Okay, here's a question for both of you. We have some questions that we've thought of to get us started today. If you could use one word to describe the state of Black health and wellness post 1865 to the current day, what would you use and why?
Who do you want to go first?
I'll go. Now, I heard I was choppy earlier. Is this a little better for everyone?
Yes.
Oh, okay. Thank you. I just wanted to verify that. So, when I thought about this question, it really took me a while to really focus on one word. So I really wrote down the pros and cons connected to where health care was and currently is in the Black community. And I came up with disconnected. Because pre-enslavement, Africans lived and survived in Africa with what we call the it takes a village mentality, right? And everyone looking out for one another. Communities were led by elders who were respected. And matters related to health were really tended to by what we call shamans and healers and priests who perform rituals to heal people physically, emotionally, mentally, spiritually. It was like whatever someone needed, these people provided, and everyone in the village knew where to go. So you fast forward through enslavement, where you so wonderfully described where the concept was destroyed and Black people weren't even considered to be human beings, let alone provided humane care. And then up to today, a time where we have made some amazing progress within the health industry and wellness spaces. However, I feel that knowledge of what services are available and where those services exist are often separate puzzle pieces in the Black community. And so care services are fragmented, especially in areas where more vulnerable and poor Black people live. And it is my belief that this fragmentation is related to the lack of understanding or disconnect that positive health outcomes are not solely related to clinical care, but they're intertwined with equitable access to affordable housing, employment, education, air quality, neighborhood resources, safety, et cetera. And so in a lot of cities, these areas of concern are addressed as independent issues and like within silos. So we talk about homelessness, unemployment, poor school systems, but rarely do we connect that to poor health outcomes. And so I think we must do better at creating spaces that serve our communities holistically under one roof and connect all of the needs that directly affect our overall health and wellness. So disconnect is my word.
That's really interesting. Yeah, that's really interesting. I love the word disconnected on that. And yeah, I absolutely agree, right? There's this, fragmentation in the communities where you don't get this type of knowledge. Rhonda, do you want to jump in on this one here?
Sure, just to build on that,
Yeah.
my that I chose is actually compromised. I feel like that disconnectedness kind of results in everyone's health being compromised. And a lot of the things that you talked about, even though, we see decades ago redlining, you're absolutely right, we still see the impact of that today. We also see how that's resulted in sort of environmental injustice as well as social and racial injustice, and the impact that all those things have had on the Black community and their health and well-being. So I think, many years ago, decades ago, and centuries ago, our health and how our life experience and our lived experience really resulted in our health and well-being. And whether that's physical, mentally, emotionally, or spiritually, all of that is compromised. So
I want to pick
still
up
today,
on that.
still today, yeah.
Yeah, yes, absolutely. I want to pick up on this point you both are making about resources, right? And like what's the availability of resources in Black communities. What resources are available in Black communities today that are focused on improving health and wellness?
Yeah, I'll go first. So yeah, I think, I think the problem is there are a lot of resources, but a lot of times our communities don't know what's available or how to access them. And then when they try to access them, there are barriers or difficulties or challenges to get what they need. But here in California, I think, tend to be a bit more progressive on the healthcare front. And so with new policies like what's happening with CalAIM and the Omnibus Act, when it comes to maternal health issues, and specifically Black maternal health issues, those are resources now that are available, especially to, I hate using this word sometimes for it, but maybe more compromised communities. I was going to say vulnerable, but I know language, really matters in this space. And so policies for me, I say make lasting change. And then again, these are policies that patients or individuals don't always know are, has expanded benefits that they can now access, especially when we talk about in the maternal health space, access to doula support for Medi-Cal patients or individuals. So I think just making sure that there's the awareness and that the information and all the resources are shared within the community is an important thing to do, but there are things that are there. And then also community health workers now here in California can get compensated for their work, which is a great thing.
Right. That's so true that there's so many available resources I find as well, Rhonda. And often people say, oh, I didn't know that existed. I didn't know that was there. And sometimes it's right in their very own neighborhood. So since we are focused on our California area, I'm just going to share some local programs and one national program that I think are really beneficial and really take away from that fragmented concept. And so we have Martin Luther King Hospital Community Healthcare Site. It's smack dab in the middle of South Central Los Angeles, where Black people work and live. And they really offer an abundance of free health-related educational courses. And it ranges from anything from breastfeeding support groups to their recipe for health food program. And I love that program because it provides those who suffer from diabetes, hypertension, obesity, and other chronic illnesses with that blueprint to healthier meal preparation. And they even provide the food to those who qualify. So those who live in other states, you may want to check some of your local hospitals to see some of the programs they provide. We also here in Los Angeles have the Community Coalition, which is located in South LA and was started about 30 years ago by then Congresswoman Karen Bass, who is now our mayor. But within this coalition is a subdivision called the Prevention Network. And it's an alliance of social service providers and local residents who really work together to increase access to prevention and treatment services related to areas that affect our community as a whole. So it's like a one-stop shop for information and resources on housing, mental health care, substance abuse treatment centers, and employment training, just to name a few. And we know all of these items are directly connected to health and wellness in the Black community. So they were like behind the campaign that closed unnecessary amount of liquor stores in the Black community. And they recently defeated a city ordinance that would have reduced the availability of drug and mental health treatment facilities and affordable housing for the poor and working families in LA. And then I must mention the Inglewood Senior Center, which is located in Inglewood, and it is a beautiful multi-level facility designed for the 50 plus and over community, and they offer 40 different classes on things like yoga, dance, and preventative health techniques. And they have a gym, they have a dining hall that serves daily lunch daily, and they offer transportation, case management, and other services that the community needs and has requested. So I think it's really important to look at those social service agencies in your community, look at park and recreation centers and those local hospitals, because a lot of times they have funding for all of these programs and we don't know, so we're not taking advantage of them when we are the most impacted by a lot of these chronic illnesses and conditions.
But can I just say, I think, all the things that you mentioned, Thea, bring up an important point, and things something I always say, like health really happens outside the four walls of any hospital, any healthcare center, and all the things that you mentioned are just that, because I think when someone shows up in an exam room or the emergency room, there's a whole lot that's happened, prior to that, precipitates them going. And so I think addressing what's called social determinants of health, right? If someone lives in a food desert or is challenged with getting access to healthy, fresh foods, it's important because we know there's, most people suffer, or at least healthcare costs stem from chronic diseases. And we know that most chronic diseases are preventable. And that goes back to a focus on nutrition, access to places to be physically active, and also lifestyle. So I think that's great. All the things that you mentioned touch upon all those things.
Yeah. And I think that's so important when you are a clinician or caring for someone, that you not only treat what's going on with that person, but we take those extra steps to talk about how they got there and also talk about how maybe they no longer have to be there. And I think sometimes that's the missing link, and some of these programs really address that and help our community with those things.
And it takes a village, I think.
It.
Absolutely. Absolutely. Thank you both for sharing so many great resources for the community to look for and check out after this presentation. Very, very cool stuff. On the other hand, what are some of the defects in healthcare system that negatively impact positive Black health and wellness? And it sounds like some of this is, again, outside of the four walls of a hospital that you might want to touch on. But what are some of the defects in the healthcare system?
Well, go ahead, Rhonda.
I was going to say, I think, I always say it's the big elephant in the room that no one wants to talk about, but that is the impact of racism, right? We know, based on some research that the California Healthcare Foundation have completed within this past year, 1 in 3 Black patients here in California specifically experience some form of mistreatment or racism that they believe is, stems from who they are or their race. And so when we look at, I mentioned earlier about the medical algorithms, right? We're all human beings. We all bleed and feel pain the same way, but there's a belief that, and it's taught in the medical school that, Black people experience pain or can tolerate pain in a different way than most other people, and that's not true at all. And so when we look at, cost of care, cost of prescription medications, and I think, for me, what my dream one day and my hope is that we can begin to really focus more on prevention as a way to practice primary care as opposed to treating the disease, and then moving away from a one size fits all approach to more of a personalized approach to caring for people. And I think, those are some of the things that are not working. We know our healthcare system in the US is broken to begin with. When we think about and compare us to other developed nations, we know that from birth, we have the worst outcomes compared to any developed nation. We spend the most per capita on healthcare, and we have the worst health outcomes in addition to our life expectancy at birth. So we're working within a system that is already broken to begin with, and we work tirelessly every day to try to help people and change people's lives within that system. It's not always easy, but not impossible.
Yeah. I agree with you wholeheartedly, Rhonda. And just to piggyback on that, I think with racism comes that lack of cultural awareness and sensitivity and humility. And I feel that there are many programs out there that were designed for Black people to promote health and wellness. And I say designed in quotes because they never really have reached out for any feedback or guidance from the Black community in developing these programs. And so many primarily white-led organizations want to simply deliver health-related services that they already have in existence to the Black community, but they just repackage or rebrand them with Black faces, and as if that's all is needed to effectively serve our community. And in many instances, if a Black celebrity or athlete endorses it, we accept it without any research on our own. And I think that negatively impacts us. And then members of these large healthcare organizations, I think they must intentionally spend time and money to research and understand the uniqueness of Black culture and Black people. They must develop trust within these same communities to obtain honest feedback and data about who we are and what we need, and not just what we call parachute in and parachute out with their numbers-driven research studies and using us as pawns, but then not providing resources and funding for education, treatment, and care surrounding their research findings in our communities. And so I think these are also a few issues that negatively impact our overall wellness as well.
Thank you. That's a lot to think about there, and absolutely right. I'm building on that a little bit. How do you think that the past impacts? I mean, how does the past impact health and wellness today, which is building on both of your points about racism being a factor? I mean, current day racism primarily. How do you think some of the maybe systemic issues of the past lead to things like mistrust and some of these other issues that you bring up now?
I'll start there. I really go back to about how we feel about ourselves. As when I talk about healthcare, it's always about what is that person thinking? Why are possibly they're in a poor health space? So thinking about that cognitively and mentally, and I think our history of being enslaved has been severely detrimental in how we see ourselves and negatively affected the level of pride that we should have as Black people, because our history should be connected to who we were before slavery and who we are now after. But in many instances, it isn't. So if you think about the word Sankofa, which in a nutshell means one should remember the past, right, to make positive progress in the future. But I always ask, how can we implement our past amazing history as kings and queens, our rich history as scholars, educators, scientists, artists, and inventors, if America is constantly trying to erase our past? And so I feel this erasure is consistently being replaced with the ideology that we are less than. Our history books depict us as slaves, and news media and social media depict us as less than and not worthy of fair treatment. Systemic racism, discrimination creates these barriers that I think become physically and psychologically exhausting to many of us. And so some begin to buy into this reality and accept the substandard resources related to health and healthcare that are provided to us, because I feel they become brainwashed to believe they are not worthy of deserving better. So it's kind of like the gym concept. You go to the gym, you work out 3 times a week, an hour at a time, you're less likely to come home and put a honey bun in your mouth, right? And I think that's the same for us. If we understand our history and who we are, I think we would take more pride in our health and more pride in ourselves, and not buy into those narratives that we are more prone to hypertension and diabetes and other illnesses, and treat our bodies more like temples. So I think the past history of who we are being erased greatly affects how we feel about our health and our healthcare systems and the services provided to us.
Wow, that's an excellent point. Yeah, Rhonda, go ahead.
And great. Yeah, and I think what you're speaking to is really the impact of intergenerational trauma right? And how, theoretically there, that could get passed down from generation to generation. There was a research study that was done several years ago that I think involved mice, and someone told me about this story, but for this research. And so it proved that whatever trauma happens maybe 2 generations ago or 3 generations ago definitely shows up and somehow is triggered when there are similar experiences, even though there are generations that have been born in between individuals, and in this case, the mice that were in the study. And so I think when we go back to the consistent oppression, from slavery, what we see in terms of how that shows up today and the stress that results from that. And we know, stress creates dis-ease in our bodies and in our lives that can definitely lead to disease. And whether that shows up as hypertension or heart disease or even diabetes, that can contribute to the stress, can contribute to the lack of sleep. And all those factors create a scenario where it could result in some sort of health condition that doesn't necessarily end up in a favorable way for individuals. So yeah, I think the impact of what we experience every day just because of who we are, how we get treated, or what our experience has been, when we interact with the healthcare system historically, when we talk about mistrust, there's the Tuskegee experiment and also the Henrietta Lacks story and other atrocities or medical atrocities that you read, medical apartheid, that have been chronicled there. There's that, I think, justification for the mistrust, and just what we experience every day when we're walking about our lives, being who we are, that all adds up. And then when we think about our mental health and well-being and how that also, influences that, everything is all interconnected. If you're not mentally well, it could affect you physically or manifest in some ways physically, and vice versa. So I think taking care of the whole person is an important approach to how we care for folks. And maybe that's something that traditionally healers in our community actually, did many, many years ago, which I think is important to think about, and getting back to our roots in terms of how we take care of, and care for our community and heal people in our community.
Yeah, that's fascinating. Yeah, definitely interesting. And it's interesting also to think about, while I think it's fascinating that, Medicare coming about, desegregated hospitals, it's also interesting to think about, there's sort of a gap after, when we think about the civil rights movement and desegregation, there's still sort of this gap where once it becomes law, it still has to get into the hearts and minds of the people, as they like to say, right? And so, there's this moment where none of these hospitals wanted Black patients to be there, and then now it's like those are the only hospitals you can go to. And so it's sort of interesting to think about. They only got it
because they believed there was something in it for them, not because they believed that, or put the patients first, or, like when they take a, Hippocratic oath to do no harm and to care for patients no matter what. Yeah, right. So it was something in it for them that drove them to that point. And unfortunately, we see that happening now because it's unfortunate that sometimes the type of insurance an individual has will dictate the type of care they receive, and it should never be that way. Someone who has a cancer diagnosis and the Medi-Cal system should never get less than the standard of care or treatment for their diagnosis. But that's a reality that does happen, unfortunately, every day.
Absolutely. Thank you. So given all of this, how does somebody advocate for their health equity individually and collectively?
Yeah. Well, I think it's important to know what your patient rights are. There is something called the Patient Bill of Rights. So knowing what your rights are, and doing your homework. If there's a health situation or even a health center that you're considering going to, you can certainly do some research about, patients' experiences there. Definitely with access to credible information on the internet. You have to be mindful about what sites you go to, but in the National Institute of Health, the Centers for Disease Control are trusted and reliable sites to do research and get information about whatever health condition that you're dealing with. So you have the facts. And I think knowing that you can ask for what you want and what you need, especially if you feel like you're not being treated fairly, or you don't think that particular provider is caring for you and has your best interest. I mean, I always talk about, Serena Williams, right? When she gave birth to her daughter, she knew something was not right, but she was dismissed, just like a lot of other Black women. And unfortunately, Antoine put something in the chat about the Olympian who unfortunately died in childbirth recently. And so if Serena Williams had not advocated for herself and demanded, and I think she actually asked for another doctor, right, to come into the room to take care of her.
Right.
If she had done that, God knows what would have happened to her. But I think, we need to put ourselves first when we're in that situation to make sure that we get what we want and we need to protect ourselves and our health and well-being, for our loved ones as well. So.
Yes, absolutely.
Guys, we have a power outage. Let me know if you can hear me.
Yes, we can hear you.
Yeah.
Okay, that was so interesting. I'm like, the joy
Welcome
of
back.
Zoom. I was like, the lights went off, everything happened. So, when we're talking about advocacy, and I believe, again, that it starts with self. I really think we have to remind ourselves that we are worthy and deserving of better care and treatment, and then really looking within at what skill sets we have to advocate for health and healthcare related equity and equality. So I always look at it as, are you great with words? And
Oh,
the power must have gone out.
oh, we lost her again.
Yes. I can kind of fill in the gaps until she comes back. I think a lot of people, again, may not know what their rights are. So if you are working with a healthcare provider that you don't feel like, again, that person's working in your best interest or on your behalf, you can always choose another healthcare provider, no matter what type of provider you're dealing with, who you feel comfortable with and who, really is intending to take care of you in the best way possible. And I think it's also important for us to, especially as a family, to share our family history. And so that we know, like if someone, especially in generations before, had breast cancer, and cancer, had been a taboo in the Black community and not talked about very much. But you go to a doctor, and when they're doing the intake and asking for your family health history, and if you say, no, there's no history of cancer, then, you're doing your family member a disservice. And so that individual needs to know, Aunt so-and-so or my grandmother, had breast cancer, and what type of breast cancer. So all that information is important to know if we are to be empowered to take charge of our health. I see Tia's trying to come in again.
Yes.
But yeah, so I think it's important, again, to start with knowing what your patient rights are and put yourself first, like Tia said, because no one's going to care for you or take care of you or feed, like you will. And so advocating for yourself and your loved ones is very important. So the work that we do, under one of our programs is really about that, helping individuals understand, how to navigate through the healthcare system, knowing what their patient rights are, knowing how to have a conversation with your healthcare provider, knowing how to advocate for yourselves and your loved ones, and also knowing that you really should be and need to be, have the right to be at the center of decision-making for your healthcare, and should own the power in that relationship with your healthcare provider. And if you can't find someone who's not willing to be a partner in that process, you need to, and especially if the provider that you're currently working with isn't willing to be that partner, then finding someone who is important.
I totally agree with that. Another message like to get across, and I don't know if you mentioned this already, is, using your right to vote wisely, researching those you vote for to put in office, and find out where they stand on health equity and health issues that really plague your community. And so I think that the main takeaway for me is for everyone to believe that their input matters, and we all have to get up and get out and do something. We all have what I call a superpower. And so sometimes you just may need to take some time to really identify what it is, and then start exploring positive and impactful ways to use your voice for advocacy.
Totally agree with that.
Absolutely. Fantastic suggestions. Thank you both. How can we begin to identify and address systemic issues like within our own Black communities that negatively impact health equity?
Yeah. Well, I think it's really imperative that Black people become involved in areas of interest and concern that interest them most. And so if they want to lend their time, voice, and energy to areas of need that they're passionate about, it's usually the desire and drive to work towards a positive change or almost organic and really effortless. And so I always ask people to think about health-related issues or illnesses that have affected them or a loved one, and to start there and start really finding that direct connection between their concerns and Black organizations that are fighting for equality, equity, and health justice in those areas of interest. So those are some of the reasons why I joined the NAACP, the National Action Network. I'm part of the Council of Black Nurses. So thinking about what's plaguing your community and what you can do to make a difference, instead of, I think, always looking on the outside, start looking on the inside and seeing how working together collaboratively, you can make those differences. You'd be surprised at what you can do and what you can contribute.
Great. And I think, Dr. Jackson, I think you may have touched upon this earlier in your presentation about, I think we've been conditioned to think that our voice doesn't matter, we don't matter. But, and I always I say, well, policies impact what happens in certain communities, whether there's investment or disinvestment. And that leads to, the resources or lack thereof, which can result in, health disparities, health inequities, and which is why, we say your zip code, unfortunately, often dictates not only your quality of life, but also the length of your life. And so we think about that circle, who is responsible for generating policies? That's people. And that's the people that we elect to office. And so voting definitely does matter. Voting in your best interest does matter. And for folks who really represent your voice and your community's needs. And so I also say that if our vote didn't count or matter so much, some people wouldn't be working so hard to take it away. So when you vote, you have to do your homework too.
Right.
That, people who are getting reelected, vote along the lines of whether it's health equity or any other injustice, but to make sure that your community gets the support and resources. So it's not only important to vote in the presidential election, but I think even more so the state and local elections. And we see that, what happened in Florida and Texas and Arizona and, other states where we see not only women's rights, but rights in general being taken away from, people. And so civic engagement, getting involved, doing your homework, really, there's data that you can get access to really understand what are the key health conditions or health disparities that your community is being impacted by. That information is readily available. Lots of agencies here in California and across the country as well. And sometimes you can just drive around and see what is happening in certain communities and see, there's a liquor store or a fast food restaurant or whatever else on every corner, but not a market that has fresh produce. But those are things that you can advocate for change around. And
That's right.
I think it's important for us to go back to, what our community did and what, Black people did in the 60s when we stood up for social and racial justice and, our civil rights. And if that hadn't happened and if we hadn't had a community that, came together to not only advocate, but become activists and really be committed to that, who knows where we would be today. So I think sometimes it's, important for us to think about the power of that and maybe even going back to, we're operating that way as a community and as a collective with, the power that we can generate when we come together for a common cause.
Right. And I think if people don't have a starting point, a lot of communities have town halls, they have city council meetings, they have chamber meetings. And that's a great way to start and really get to know those local leaders in your city and your community and really listen to what the community is talking about and then begin to start that process of engaging in how you can make a difference.
Fantastic. Thank you both so much. This has been a fantastic conversation. It's 10:06, so I think we should get to audience questions. There seem to be quite a few really excellent questions in the chat. So again, this has been a remarkable conversation. Thank you so much for all that you've said. I want to welcome AARP volunteer Joyce Howard to help us with questions. What questions do we have from the chat, Joyce?
Well, thank you, Dr. Jackson. You're right. This has been a very informative workshop. I'm so happy that I'm here. I'd like to do a quick shout out because I looked at the chat and there's actually somebody who was born there in 1959, Priscilla. So that's really important. I'm sure she's probably smiling and saying, yay, that's where I was born. But I do have another quick question from our YouTube member. Her statement is this is from Maryland. She says, why is high blood pressure so high in the Black community? And what can be done about this disparity?
I'll let the nurse answer that question.
It's a loaded question.
That's a loaded question.
Oh my gosh. But it's a great question. And so one thing I want to first say is that please don't buy into the narrative that Black people and high blood pressure are directly connected. Because when you buy into that narrative, you really feel like there's nothing you can do. So it's mostly related to our dietary intake and our lifestyles. Okay. And so when you do those windshield studies, as Rhonda mentioned, driving through these communities, you don't see places that have healthy food choices. We don't go into stores and often have healthy food options. And there's not a lot of education based around healthy eating, especially when we go to those clinical visits. A lot of times the doctors are teaching us about the medication we need to take for high blood pressure, but not about how it happened and how we can prevent it. So I think the community needs healthier food options related to dietary intake, but also lifestyle, the sedentary lifestyle, exercising, getting out, moving around. And if you don't live in a neighborhood that have safe spaces to do that, well, that's going to contribute to your more being sedentary and also obesity. And so obesity also is a contributor to high blood pressure. So there are a lot of factors that lead to high blood pressure. And as I talked about it earlier, it leads back to our ancestry. When we were enslaved, we were given the scraps and the slops and the things that no one wanted to eat, and they were not healthy. And we became really programmed to use all these extra things that were unhealthy to make our food taste good and rich. And so a lot of those things are unhealthy and they contribute to our high blood pressure and to diabetes. So I think we just have to get away from the narrative that high blood pressure is just what we are more than likely to be a factor in our health condition, and more into how can we live a healthier lifestyle and not have high blood pressure, and have those conversations with our clinicians and those taking care of us.
Thank you so much. That's a great answer because I've heard that so many times and I think people just buy into that.
Mm-hmm.
We have another question from our YouTuber, Lee. He said, can you speak on the alternative medicine options for Black Americans?
I can take that one. So,
Okay, great.
So I think, alternative medicine, just for those who may not know what that means. So it's a blend of the Eastern way of medicine and the Western way of medicine. I think what we see in the Western or traditional Western sense, it's about treating the disease, right, is through pharmacological solutions and surgical solutions, whereas Eastern practices are more so getting to the root causes of whatever health issue you're dealing with. And so alternative medicine is often called integrative medicine, where you blend the two. And so I think it's available for everybody. It may not always be available in the Black communities. I think what we see is, communities or populations that have more resources have access to those things like acupuncture or, working with an integrative nutritionist or nutritionist in general. But I think those are practices that we certainly can adopt into our community. Like, it doesn't cost anything to do meditation, right? You can, while you're sitting in your car in traffic on the 405, you can take 5 minutes and do some deep breathing, or just think about being somewhere else, like on a nice beach, instead of being stuck on the 405. That can help alleviate stress. Or sitting at your desk, same thing. Or if you have an encounter with someone at the office that causes you stress, you can take 5 minutes or 10 minutes and decompress from that. And so really thinking about, what foods we eat and our caloric intake, along with the types of food, I think is also important to think about. Yoga is also something that you don't necessarily have to have a gym membership or go to a yoga studio to do. You can do that at home. And you can find ways to practice yoga even on the internet. YouTube has some great yoga classes that are free or, instructed by professionals. And so those are options that, are part of that alternative or integrative medicine approach that you can have easy access to. And, there are folks in the community that do holistic medicine, but make sure that they actually have the proper credentials before you actually start working with them.
Yeah. And I know here in Los Angeles, we have an amazing apothecary store. I won't name names, but there's a great apothecary store. And so look in your community for spaces like that, because as Rhonda mentioned, you want to make sure they're certified and they know what they're doing. But it's a great one-stop shop to go and really talk about those health conditions. And it doesn't have to be an illness. It can be preventative. And they can provide you with information, herbs, teas, in order to really address your overall health and wellness, even when it just comes to anxiety or stress or depression. And so look in the community for those resources. Look on your phone for apps. And to when Rhonda was talking about acupressure and those types of things, check with your insurance company. A lot of times people say, oh, it's not covered and it's expensive, but you'd be surprised what services under alternative medicine are covered. We just don't know, again, to ask. So it never hurts to ask, is this covered? Maybe it's just 10 visits or 4 visits, but it's something. And so look at those services and really look at those Black-owned services in your community as well, in order to really be with those who may understand you more culturally and understand the community that you're in.
Yeah. And there's a really good book called The Garden of Eden. That is a good reference if you're looking for more natural and alternative solutions.
Nice.
These are great questions. Oh my God, time is running out, but again, thank you so very much for this wonderful workshop. And I call it a workshop because I learned so much about this one. So what a great event. So much to think about to get us on the road to better Black health and wellness. So let's start with the final poll for this for this morning. And the question is, have you learned how to locate health and wellness resources in your community to improve your health or your health of others? Oh, wow. Answers are coming in. I'm so glad everybody was really paying attention. That's great. Thank you so very much. And hopefully you'll be able to use some of those resources that was put into the chat. And then also Googling information is also important. And of course, seeing your practitioner. Thank you so much. So I enjoyed this very much, and hopefully you enjoyed it as much as I did. So check out our chat. Sharing results, and I'll end it. Okay, so check out our chat for a link for our list of our activities and resources you can use for better health outcomes. We also ask you to complete our quick survey at this event by clicking on the link in the chat that includes the word survey. Visit our page at aarp.org/ca to access our event calendar and to learn more about our activities. We hope you will continue to engage with us by attending more future events or even volunteering, because all of you, I'm sure, will have something that you can give to our organization and also to share with others. I'd like to thank you so very much for attending. Special thank you to our moderator, Dr. Jackson. What a great Dr. Jackson did a great job. Our guest panelists, Tia Delaney Stewart from the Eyes of Love Nursing and Rhonda Smith from California's Black Health Network. Our staff, Marissa, Atisha, and Antoine. Our volunteers, Jacqueline Cole and Connie Moore. And of course, to you, our AARP audience, for attending. Have a great rest of the day.